Hello, my name is Jamila Jemison. I'm the head of clinical development at Healthmode, and I'm going to talk to you about measurement solutions for next generation medicine. Clinical trials and modern medicine depend on quality measurement. Unfortunately, measurements are often infrequent, self-reported, due to a subjective observer or taken out of context of a patient's daily life. For example, if you're measuring weight in the clinic during 2 visits a year, you might get one idea of how this person is doing with their weight management. However, if you had them take daily weights at home on their own scale and recorded them, you could get a much more rich set of data and even a different context on those 2 time periods when their weight changed. So digital tools can take continuous objective measurements in the context of a patient's daily experience, and that continuous measurement provides a more complete study. Healthmode delivers digital measures for AI-enabled clinical trials the next generation. We begin with the end in mind, working with you to refine your question and choose the right data set. We go through a data acquisition process where we collect multi-channel data enriched with patient annotations from ePros. We analyze that data in the context of the annotations to develop a model which automates the data output that you need to answer your question. We do this in parallel with engagement with regulatory authorities to ensure a path to authorization as we produce the product. Healthmode works with familiar user-centered technology with a platform approach. This allows us to reuse pieces of the basic functionality and customize other portions of the tool to optimize for multiple targets within various therapeutic areas. To take a closer look at our portfolio, cough is our lead measure. We have the capability for continuous or user-triggered cough recording, allowing us to look at cough count, cough frequency, and characteristics of the cough sounds applicable to many respiratory diseases and instances where cough may be a symptom of a disease or a possible adverse effect of a therapeutic. We were quick to respond to the COVID-19 pandemic, stretching our cough application to 4 modalities, allowing folks to record coughs anywhere they were on their smartphone, by calling in on their website, and or on a fixed point recording device, which you could deploy in a conference room, in a locker room, in a place where people are waiting in line for tickets or security. We are testing this app right now in a large multi-cohort IRB-approved study of the cough characteristics of cough and COVID-19. Healthmode is also in a joint venture with the University of Southern California, where we're developing a holistic, continuous objective measurement of performance status using ePros, activity data, and physiological data to get a clearer picture of each user's day-to-day performance, applicable for cancer treatment and other progressive diseases. Pain is always undermeasured and rarely looked at longitudinally. With our pain app, a person can give multiple ratings of their pain per day. They're all collected, and they can look across a day, a week, a month to understand patterns in pain that may inform treatment. We have a gastrointestinal app called Pooply, which allows users to record any and every bowel movement each day with its associated symptoms. It takes less than a minute to go through the data collection process for each bowel movement, and each bowel movement is marked in a calendar-like log, which allows the user to go back and observe changes in their bowel habits or even share these with their doctor. Agitation is a disruptive and common symptom in neurodegenerative, neurocognitive, and psychiatric disorders. But it can be managed with de-escalation if it's caught early enough. The Healthmode Agitation app learns a user's baseline activity and physiological status, and then can identify when they're flipping into an agitation episode and provide an early warning to a caregiver who can then come and intervene. The Healthmode team has broad experience in pharma, digital health, and academia, and we look forward to designing the best measurement to answer your next question. Thank you.
My name is Michael, and today I would like to tell you about Planet and its contribution to prevention and treatment throughout lifestyle changes. As we all are aware, the numbers of overweight and obese people worldwide are critical and still growing. Same situation is in diabetes. High blood pressure kills millions yearly. Same with high cholesterol. Healthy lifestyle and balanced diet is obviously the answer, but not surprisingly, it's not enough to say or know it. We are all unique with different needs and preferences. Some prefer paleo, some are vegetarian. Some have one or more allergies or intolerances. Some are diagnosed with diabetes or high cholesterol. Some are active, some sit most of their days behind the desk. Some can afford more expensive food, some not at all. And of course, we all have our taste preferences. For example, to prefer potato instead of rice. A specialist would spend hours preparing a personalized nutrition plan reflecting on all these personalized elements. Hence, only few doctors and nutrition experts are providing such personalized and high-quality meal plans. But without a meal plan that fits the client, there is almost no chance to change his or her lifestyle and improve their health. Worst case is when patients turn for help to Google and end up harming their health even more thanks to questionable diets or products. That's why we developed simple but powerful online application that works with know-how provided by experts for experts. Top medical and nutrition experts, as well as scientists, were part of the team from the beginning. Tons of their know-how is combined with heavy calculation logic in order to provide professional, user-friendly, but mostly fast meal plan generator. The meal plan proved to be effective for obese clients, but for top athletes, we need to improve performance as well. Our generator, with its speed and complexity, is something quite unique in comparison with the competition. Average meal plan generation takes only few minutes instead of hours. And the result is fully personalized meal plan reflecting the patient's preferences and medical condition. On top of that, Planet can also help professionals to analyze current eating habits of their clients down to the micronutrient level with a helpful heat map indicators. Our app also helps the user to calculate energy intake needs. It also keeps track of all important events, so you don't have to. And much more. The solution is now available in Slovakia and Czech Republic, with more than 3,000 registered users. With more than 15 medical conditions covered from obesity, diabetes, up to sclerosis multiplex or Parkinson's disease. We are currently in translation and localization process for the DACH region, with entering Austria in few weeks. I would like to thank the organizers of the conference for the opportunity to promote Slovak Health Tech. There is my email for anyone who wants to know more about Planet or talk about partnership opportunities. I leave you with a quick overview of the app as such. Goodbye and have a good rest of the day.
Hi guys, I'm here to present a startup called Learning to Sleep, and the guy who's talking to you is me, Michael. I am the CEO and one of the co-founders of the company, and I've been working with Learning to Sleep since 2015. So what do we do? Well, basically we help people who have sleeping problems to sleep better, and we use a digital platform based consisting of a mobile application together with a backend system in order to do that. Just to summarize what we do, we had a great year last year. We had 25% growth month on month, but maybe the thing we are most proud of is that we have 94% success rate. That means that 94% of our patients gets a sleep improvement. And we also have a proven revenue model. We have revenue in Sweden, and at the moment we are expanding into Norway and the UK. If we look at the problem with sleep, sleep is a global health issue. And we know that about 40% of the working population sleeps less than 6 hours per night in most European countries, which is a huge cost for society. And we also know that this is a huge cost for the healthcare system. We're talking about over $500 billion per year as the cost of bad sleep. So what do we do? Well, basically the patient gets a mobile application where all the treatment is done. And in order to get good adherence from the patient, all patients also have an assigned psychologist. So everybody has their own psychologist, and the psychologist follows the patients through a backend system. The backend system consists of course, the monitoring, but also of a communication platform. So patients communicate with their psychologist through the platform using a secure line, using voice, chat, or video, whatever the patient prefers. This secures that the patient actually does the treatment, which is 5 weeks, in a proper way, the way we want them to do it. Technology is quite simple. We run everything on AWS servers, and of course we are CE marked, registered according to MDR, and fulfills the GDPR regulations. We're also HIPAA compliant for the US market. Back in 2015, we did our own clinical study showing that 94% of patients gets better, but also that we get a huge improvement on the scale ISI that we use. We will do an extended study this year together with Karolinska Institute in Sweden. If we look at business models, we do have a clear B2C model in Sweden. We are reimbursed by Swedish healthcare system and acquiring the patients by ourselves. The patient pays a small fee and we get the rest of the payment from the state. But for other countries we have developed a SaaS model, so we will actually sell the system, and we're trying that out both in Norway and UK at the moment. And as I said before, we did have great success last year and very good revenue, and that has continued during 2020. Maybe what we are most proud of, a lot of satisfied customers. This is Fia. She's one of the Swedish influencers on health. She actually did the treatment and wrote about it on her Instagram account, which we are so proud of. We are a dedicated team. It's me, Peter, and Lina, who are the management team, all with great background in healthcare. We have a chairman and a financial partner in Sandra, Andreas, who works with customer satisfaction, and then of course a dedicated tech team. Upcoming challenges for us will be growing this year, and then actually using all the data we gather into an AI solution for the future. Thank you so much for listening. Hope you enjoy the session. Bye.
Hello everyone, my name is Marek Szebo. I'm the CEO of PaxBrain and Cognition, and today I'm gonna tell you a bit more about the problems of computer-aided diagnostics in radiology today, and how at PaxBrain we are working to fix them. Breast cancer is the leading oncologic cause of death among women worldwide. Fortunately, there is a proven diagnostic method that increases survival rate. It's mammography screening, and the authorities recommend that it's performed annually after a certain age. That creates, however, a burden on the radiologists who are tasked with an uneasy task of screening the mammograms and searching for tiny lesions, tiny microcalcifications, specular masses, etc., and assessing the malignity. It's no wonder that in this tiring and error-prone task that consumes a lot of time, there has been effort among not only academia and the big brands like IBM, but also among startups, and there are several solutions on the market that are performing the first screening for the radiologist and are evaluating those markers automatically. But despite the billions of dollars put into development of such solutions and the years of development, there is a problem. The solutions fail to generalize. That means that though the solutions perform on the test sites, technically on the type of data that they were trained on, the problem comes when they start to be used on other clinics, and those CADs fail to cope with the variability among the scans that are present in the data on these other sites. The solution in AI was always to get more data and train those neural networks. However, this is an expensive way, and we are still not in a stage where we have a globally acceptable solution. It all boils down to a problem of training the neural networks that are the algorithms that are in the core of such systems. The conventional wisdom is that one needs thousands to millions of images to train a neural network that can evaluate images. At Cognixa, we have wrestled with the problem for several years. We gradually decreased the number to insanely low numbers, like, for example, 2 images needed to train this solution for reading of text on the ID card. Actually, this is for training 2 neural networks, and the system is robust enough that it performs in 8 countries and has tens of thousands of users every month. So why not use it in solving the great challenges in radiology? The magic is the synthetic data generation that is that we are using algorithms to artificially create realistically looking data that are fed to the neural network, and the neural networks are trained with those data without actually needing to expensively collect those millions and millions of mammograms. This ensures the creation of a very robust solution, because the network won't be confused when it gets something that looks slightly different, because it has already seen it. Combined with other technologies, we get a solution that performs well at screening patients all around the world. And because it's only technology, it's applicable for a variety of imaging technologies and not only for mammography screening. PaxBrain is a joint venture by the technology partner Cognixa and one of the most innovative healthcare organizations in the world, the Israeli Me'ohedet. We have a great leadership team which ensures not only the medical guidance over the solution, but also its product vision. And we are open to collaboration. We want to get the solution to use as soon as possible and to improve the standard of radiology screening worldwide and to combine this with the technologies by other companies, startups. Thank you for your attention, and I'm ready to answer your questions and to start the conversation.